So good morning, good afternoon and good evening all. A very warm welcome on behalf of the IPB events team. We're very much looking forward to supporting you with today's Advocacy to Action webinar, Strategies and Tactics. I'm now delighted to hand over to Jude to welcome you to the webinar. Thank you.
Hello everyone. It's wonderful to see you all here, so many friendly faces online. Welcome to everyone who's joining us from previous Advocacy to Action sessions, and wonderful to see those of you who are joining us for the first time in this series. Thank you all for taking the time out of your day to be with us here. My name is Jude, as Deb said. I'm the Head of Knowledge Management here at IAPB, and I'll be your moderator today. I'm moderating from Sydney, Australia, or more specifically, the Gadigal lands of the Eora Nation. And I would like to acknowledge the traditional custodians of the land from which I am hosting this session and pay my respects to the elders past and present. I extend that respect to Aboriginal, Torres Strait Islanders and all First Nations people here with us today. Whilst I'm moderating today, I'd like to introduce some of the IAPB team present on the call and who have worked extremely hard to bring this session and all sessions to you. And in particular, I call out to the team, Jissa, Holly, Tasia, and Debs, and Jess, all of whom are critical in the delivery of the A2A program. And also like to take the time to acknowledge and thank our sponsors. We're really delighted to have such a large number of sponsors for the Advocacy to Action program. And without your support and encouragement, it would be much harder to deliver this program. So thank you to Apasami and Associates, Bayer, CBN, Fred Hollows Foundation, Global Coalition on Ageing, International Federation for Ageing, the Lions Club International Foundation, Novartis, OneSight, Operation Eyesight, Planoptica, Roche, Saver, Vision Impact Institute, and the World Council of Optometry. And it's wonderful to have you as part of the sessions and all the people that have joined on as well that are involved in those organisations. So now that I've introduced our team and our sponsors, I invite you all to take about 30 seconds and introduce yourselves in the chat. Please let us know your name and which organisation you're from, and so that the others on the call can see everybody and connect with some new friends and some old friends. So I really encourage everyone to please just take a minute and put your name and organisation in the chat feature at the bottom of the screen. And while you do that, I will, sorry, I'm trying to see the chat and the notes at the same time. So today's session is the fourth in the Advocacy to Action series. Thank you for starting to put your names in the chat there, and please keep doing so. Feel free to say hello to each other as well. So today is the fourth in the Advocacy to Action series. In the series so far, we've discussed the broad eye health advocacy agenda to 2030, evidence-based advocacy, and we even looked a little beyond eyes and looked at the links we have as a sector with the SDG agenda. We've heard from 14 different incredible speakers and engaged with over 300 people in live audiences and over 600 further people watching the recordings afterwards. So today the focus will be on advocacy to act. Today the focus will be on strategies and tactics. This session is organised a little differently to some of the past ones that we've had. This one is organised into 3 showcases. Each showcase will feature 2 speakers and then have time for questions, your questions, after those presentations. Speakers are being worded up. They're short, sharp presentations of 5 minutes each so that we have plenty of time to answer questions. This is something we've listened to in your feedback, so please have your questions ready for our panellists. The other thing we'll be doing today is using polls. And as always, we would like to make sure that we have the technology ready to go and you guys are ready to use it. So we have 2 starter polls to warm up with to get to know each other a little. We use Slido for the polls, so you can type slido.com into your browser and add in the hashtag 515391 to join the room, or you can use the QR code, scan that in and also enter the code. Once you're on, our first question is to do with the Olympics. It's a big thing in my household. I'm sure it's the same for at least some of you. Which is your favourite Olympic sport? And yeah, great to see some people online. Track cycling, which I think was big today. Swimming, gymnastics, lots of swimming. Must say, as an Australian, swimming is something that features heavily in this household. And rowing, dressage. What can I say? Handball, I think. BMX, yeah, the first BMX ever in the Olympics, which was great to see. Athletics, so yeah, keep it coming. And we will move to the second poll in just a second. Just give everyone a chance to actually have registered on. And you can see some of it coming through in the chats as well. The athletics, which has just started in the last day or two. And the rowing is up big. Okay. And looks like from the word cloud that rowing and gymnastics are the two most popular sports for this crowd here. Maybe it has a little to do with what was on today. Football starting to make a presence too. When you're ready, Debs or the team at MIT, if you could flick to the second poll question. And what we'd like to know is where you are joining us from today. Our IAPB community is truly a global one, and it's always great to know who's online from where. And we acknowledge that we can't straddle all time zones in one webinar. And so for those that are watching the recording, we also really glad that you could join us from wherever it was in the recording. So looks like people have the hang of this now. We have a really good variation, a variety of people. London appears to be the most common place. We have Australia, Beijing, Nepal, India, Vienna, Germany, Cairo, Nairobi, US, New Zealand, Jakarta, Bangladesh, San Francisco, another Bangladesh. So really spread out across the world, always really good to see, and everyone's really welcome, and we really invite you to share your takes on advocacy as well throughout the questions today too. So thank you all for jumping on. You can keep answering that poll in the background if you like. But now we get down to business. We're really privileged today to have an incredible lineup of global speakers to talk strategies and tactics. Our speakers are from a really diverse range of backgrounds, from ophthalmology and eye care to business and entrepreneurship to advocacy and campaigns. Please give a warm welcome to Katie Overby from One Sight, Dr. Bo Wiafi from Operation Eyesight Universal, Ashley Mills at the Vision Council, Dr. Anna Farmer from Fred Hollows Foundation, Kevin Cahill from Comic Relief, and Shivang Dave from Plan Optica. I will briefly introduce each before their respective showcase, but I know that will not do justice to the impressive list of achievements and recognitions each of our speakers have. And so I encourage you to have a look on the IAPB website or on people's LinkedIn profiles for more information. So our first showcase to start off the evening is Building Coalitions. Our first speaker is Katie Overby, the President and Director of One Sight, ensuring operational excellence in One Sight's global vision care programming, while also enabling future scale through the development of strategic partnerships and a diverse funding pace. I've had the privilege of working with Katie recently, and she's very involved in IAPB, both the UN Friends of Vision and the Clear Vision Coalition. The second speaker following Katie will be Dr. Bo Wiafi, with more than 35 years experience in eye care, and I believe he is recognised as an authority in the development of sustainable eye care in Africa. Dr. Wiafi is the Medical Director of Watborg Eye Services and Technical Advisor to Operation Eyesight Universal. He has served as Director of Quality and Advocacy at Operation Eyesight Universal, engaging with eye health providers, ministries of government, corporations and other NGOs. So Feel free to type questions in the Q&A box as you go, and I will curate them and ask them of our panelists after their presentations. Please make them feel welcome. Over to you, Katie.
Hello, everyone. It's such a pleasure to be here with all of you. Russell, can you throw the slides up, please? Thank you. Next slide, please. I wanted to share a few thoughts this morning or this evening in terms of bringing together people in a committed coalition or alliance in order to drive for real change. Next slide. A couple of thoughts in terms of principles for how to put a coalition together. Really, and as Jude just mentioned, I've been very involved with the development of a recent coalition, which is now being called the Coalition for Clear Vision, focusing on refractive error, as well as several others within the sector. But these are a couple of the key questions that we really focused on as we were bringing this together. So the first is clearly define what you're trying to achieve and why is this important. That will be the fundamental aspect of how the coalition moves forward effectively. Related to that, being very, very clear on what is it you're trying to do? What will the outcome be? What does success look like? I also think it's very important whenever you're bringing a group of people together or a group of organizations to really critically assess how is this going to be more impactful than everyone working together or individually? Because if you can always focus on that, you're going to be focusing on what are the key elements to really pay attention to. Why should people join in this effort? How will that make a difference? And then be very, very clear on not only what are you going to deliver, but when will you reach that? Again, so that you can critically assess, are you making the impact that you want? Are you moving forward in advocating for whatever the change is? I always think it's very helpful to lay out what are actual key milestones so that you can look at the progress you're making. Next slide. I also think that as you're pulling together a group and as you're thinking about what you want to deliver and how that will make a difference, you have to be very clear on who do you need to be a part of that coalition or that alliance. Making sure that you've got different points of view, different skills, and it may be people who can stretch the thinking. And then also thinking about now, whom do you want to reach out to and influence so that you have a very, very clear target on how you will move forward and reach people to make the change that you want to. So in addition to some of the key elements that you want to think about as you're building an alliance, I also wanted to just highlight a couple of watch outs or things that people need to keep in mind that sometimes can derail these efforts. Next slide, please. So the first is oftentimes when you bring in people who are representing different associations, or maybe if you're in this position yourself, you find yourself thinking, oh, which hat should I wear? You know, I think all of us spend a lot of time thinking about the particular organization with which we work or the area on which we're focusing. And sometimes you have to think about, well, what is this group doing? And how do I think about what that objective is versus, you know, what my individual organization wants to focus on. And what I often tell people is, if you've designed the coalition well, those two should be in sync so that all of the members of the coalition feel that by moving the alliance forward, that's going to be in the best interest of the individual organization. And that's how you really do get to this synergy of what I call the 1 + 1 = 3, where truly being a part of this and moving it forward can help everyone move further than they could individually. Next slide. I also always encourage people to think about having an abundance mentality. I think so often, particularly those of us working in NGOs, we're faced with the challenge of, do we have enough resources? Do we have enough people? Do we have enough of X, Y, or Z? But when you think about a coalition and you really look around and you realize that between the combination of all of the people you've brought to the table, you have so many experiences, you have so many technical experts, you have so many connections within your network. And when you start to focus on all of those things that you actually have, I think you can flip the perspective in order to start thinking about all of the things that you actually do have at your disposal and how you can move forward with that. Next slide, please. So with that, again, just a very brief overview of things to consider as you try to bring people together and move forward to truly make impact. So I will leave you with this proverb, which I'm sure you've all seen before. And at this point, I'm happy to turn it over to Dr. Bo. Thank you.
Well, thank you, Dr. Bo. If you could just adjust your webcam slightly so we can see you.
Okay.
There we go, at the moment. That's better. Thank you. Over to you.
Good morning, good afternoon, good evening, everybody. I'm very delighted to be able to interact with you and learn from each other. As you heard about me, I have been practicing ophthalmology for several years, but I've had several roles in making sure eye health gets to all who need it. As the topic says, coalition, and we've had several encounters in this area, but I just want to make sure we're all on the same page. Coalition simply is a group of individuals representing diverse organizations who agree to work towards a common goal. And here I would want us to look at the fact that we should focus, that goal should focus on what individual organizations cannot do on their own. We should be the bridge to enhance existing services. We shouldn't be competing each other, but rather make sure we get to the goal we set out to be able to do this. I want to share a few of our tricks. The communication is very, 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 very essential. We should make sure that we communicate and communicate and communicate. We engage and build enthusiasm around that opportunity we have and the goal we want to reach. Second one is transparency. It is very important to be transparent in the decision-making process. We have to make sure that the ownership is everybody's. We have to listen, and listening is very, very important. You have to have your ear to the ground to get input from quite a range of stakeholders, and also ask for advice from the coalition members. Doing so shows respect for them, and this helps to keep the coalition together. Next slide, please. Next slide. Data is very, very important, and we use data to establish the urgency and request for support for that change. Creation of partnerships to establish the change action. Then we identify policy goals and establish an advocacy vision. A number of times we found out there's even no policy, and that becomes an opportunity for us to start working towards creating a policy which will actually make sure the accessibility is reached very quickly. We create more advocates through the collaborations, because each one will take it to their various organizations, and then they continue with the trick. Maintain the momentum by acknowledging and communicating success. And an example is the trachoma, which was eradicated from Ghana a few years ago. There was a celebration, and that gives the coalition more vim or momentum to go ahead and do much more. Then monitoring and evaluation is very, very important, because there we'll be able to actually know where we are, where we're going, whether we're able to be on target, and so on and so forth. Next slide, please. We came across barriers or roadblocks. And the first one was the lack of clear goal setting or unrealistic goals. And this is very, very important, because if you set goals that you are unable to achieve, it actually disappoints and discourages the coalition members. Lack of commitment by participants, by the members. And this is why it's very important to carefully select who is going to be part of the coalition. And lack of education in specific external barriers, and we will look at them in the next one. The external barriers that we are looking at is lack of access to the traditional power structures. As you know, most of our members are all non-governmental organizations, and a number of us have never had experience in working in the government, and so that becomes a challenge. The inability to know how the bureaucracies work. Then fast turnover of decision makers. You will go so far with your advocacy interventions, but the next elections come, you find you have a new set of decision makers and you have to start all over again. Then decision makers not well informed of the need for eye care. And this is something that becomes quite a barrier. Next slide, please. Now, outcomes. I was an example of a coalition that combined service delivery with advocacy. Some of the wins realized by our coalitions included securing new funds for eye health programs, hosting regional meetings, expanding access to a cataract surgery program, able to carry out national blindness visual impairment study through coalitions, managing to get prices of some medications reduced, example, glaucoma drugs in Ghana, ensuring that low-income individuals have access to glaucoma medication. Next slide, please. Next. And the impact. We found out that coalitions are tremendous agents of change. Virtually every carefully drafted coalition can have an impact. A common agenda or coming together to collectively define the problem and create a shared vision to solve it. Establishing shared measurement or agreeing to track progress in the same way allows for continuous improvement. Mutually coordinates collective efforts to reinforce activities or scaling up best practices to ensure better outcomes, fostering a continuous communication or building trust and relationship amongst all the coalition members. There's a strong backbone that is dedicated to others. And it's very, very important for us to make sure that this coalition continues. And it's always, I don't know how to put it, but it's not crafted in stone, but it's supposed to be shifting. That goes, look for the opportunity, look for the need, and then come up with a team that can help address it. Thank you so much for your attention. Thank you.
Thank you so much, Katie and Dr. Bo. Really wonderful presentations and lots of great tips and tricks for forming and working in coalitions. We're lucky to have such great examples in our sector, actually, of strong coalitions and success. I know I have several questions for you, so I invite the audience to put some questions in Q&A in case you want to get there before I start asking my questions. Before we get to the Q&A, we're going to go to a quick poll so that we can also have an idea of the coalitions that everyone on this call is involved in, because it is quite widespread across our sector. So if you can go to slido.com again and just type into the poll, what advocacy related coalitions have you been engaged with in the eye care sector or outside the eye care sector, actually? Which ones, if any, have you been engaged with? Okay, thank you. First person for answering, Vision for the Commonwealth. I suspect there was a few people involved in that. Worker eye safety. UN Friends of Vision, iAlliance, trachoma elimination, Campaign for Australia Aid, Access, Awareness, Affordability, Pandemic Solution Team, and there's quite a number of those around, the Australian Blindness Initiative, iBank Associations and National Blindness Prevention Programs, Make Poverty History, which is great. We'll be talking to Kevin later on. IPB Advocacy Group, trachoma elimination, Vision 2020, Right to Sight, absolutely. Some really wonderful examples. Rohingya refugees, Vision 2020 Consortium, Lancet Commission on Global Eye Health. So you can see from all the commissions, coalitions that are coming up through there that it's quite a familiar way of working, and we certainly have had a lot of success in the eye care sector. We've also certainly, I'm sure, all struggled on various different coalitions as well. There's been a few that are a bit beyond the eye care sector, but as we look forward to 2030 Insight, we're looking at broadening those coalition strategies. So I'm going to go to the questions and answers now. If we can just flick back to that. So Katie and Dr. Bo, you said so many wonderful things about working together to that 1 + 1 = 3, and that working towards a common goal, and particularly around things that you just wouldn't be able to do on your own. And so it would be really great if you could both share with us perhaps one of the critical success factors that led to success of the coalitions that I know you've been involved in. Katie, the successful UN Friends of Vision that got the UN resolution, I think it was last week, which was amazing. And Dr. Bo, the coalition that you were involved in to eliminate trachoma in Ghana, also an incredible achievement. Perhaps you could just let us know what you think the critical success factor was about in these coalitions.
Thanks, Jude. I'll go ahead and start. So when I think about the resolution that you particularly mentioned, I think there were a couple of really critical factors there. The first, and this is echoing some of the things that both Dr. Bo and I mentioned, is there was a very clear objective in terms of what we wanted to really deliver and the impact we wanted to have there. I think the second was particularly with the UN Friends of Vision, we knew that we were focusing on a particular key target audience. We knew who we needed to talk with. We knew that we needed to really bring along that broader group to make it become a reality. And that was where we focused a lot of efforts in the lobbying and in the thinking about the writing and how do we bring people in and how do we influence. And then I guess the last thing I would mention, which I think is critical to any coalition, is a collective willingness to work together for that broader cause or that broader deliverable.
If I may add something from my experience, there is this issue of respect for each coalition member. We need to respect the interests of the members. We should respect their strengths and what they're bringing to the organization. It may not be a very big organization, it may be a small organization, but their contribution should be respected and valued. For example, in the trachoma elimination program, we brought in quite a variety of partners who are not traditional eye people. For example, you have the water and sanitation group, you have the Ministry of Local Government, we have the education, we have the definitely the health people as well, who are doing the trachoma. And together, we come together, each one harnesses their own, what they are good at. And together we're able to address the issue, because I, as an eye specialist, has no way of knowing how to bring water to the communities. And so I need to respect what they can do. Another one is adaptability. We should be willing to not compromise, but to find common ground, okay? Find common ground to make sure that, I mean, there's that flexibility, not sticking to what your particular organization sticks to, but you have to be flexible when you're in such a coalition. In that way, you're able to. And then, like what Katie said, the role should be clearly understood. Clearly understood. And with that, we're able to actually move forward and move fast. Thank you.
Yeah, that's really, really wise words. As always on these webinars, time is moving quickly, but I do want to ask one question because we've had a couple in the same ballpark. Looking forward to the next decade, which coalitions within or external to iCare are being formed that may be of interest to people on the call? There's one specific question around Bangladesh, which I'm not sure that we can answer, but we can park that and get back to them. But just the coalitions that you know of, if you can each mention 1, 2 at the most, that people and how they might get involved.
Well, I'll mention one, Jude. I referenced it in the talk earlier because it is really quite new, which is called the Coalition for Clear Vision. It is focused on refractive error, and we'd really welcome participation from anyone across the sector, because it is all about how do we bring people together so that we can actually unlock resources and opportunities that we can't do just as individual organizations. So I would offer that up.
Wonderful, thanks, Katie. And Dr. Bo?
Yeah, I looked at the next 10 years, what's ahead of us, and we really need to think outside the box to be able to get to what we have aimed at doing. I'm looking at with persons with disabilities. There's that group out there who are doing their own thing, but we really need to find our way into that group as well and see what we can do. And then with financial institutions, again, one clear example, Stanchart had the Seeing is Believing project, which went very well, had great impact. What about all the other banks out there? And then another one is, this may be very, very wild, but use of drones in the delivery of essential eye medicines to places where it's not reachable. Or you are out there doing some surgery and you run out of some material, or you can call the drone to deliver it. So we need to get ourselves into all these groups. And then last and not the least, integration with the government's approach. Because when we had the COVID, we had a clear example where the government engaged all the departments, the security, the education, transport, finance ministry, everybody brought hands on deck. And we saw their importance. We were able to actually bring the COVID under some control. Why can't we do that with iHealth? I rest my case here.
Great. I think there's a lot of great concrete ideas and food for thought, concrete coalition to join, and also food for thought about the types and groups of people that we should be creative and innovative and including in our coalitions. Please thank Dr. Bo and Katie for their wonderful words tonight, or today, depending where you are. And I need to move on to our next showcase, but thank you so much. The next showcase for today is Engaging Decision Makers. And I'm thrilled to introduce our next two speakers, Ashley Mills and Dr. Anna Farmer. Ashley leads the Vision Council in helping people achieve better lives through better vision. Ashley has been extremely involved in the UN Friends of Vision Coalition and engaging decision makers through that mechanism in terms of in the IAPB space. And Dr. Anna Farmer is family. Many of you may be unaware, in the years leading up to 2016, Anna was the sub-regional coordinator for IAPB in the Pacific Islands and also the president of PAC Eyes, which is a professional body bringing together the eye health community right across the Pacific Islands. Anna is currently consulting for Fred Hollow's Foundation Australia, working to bring together disparate members of the WASH sector in an effort to eliminate trachoma in the Pacific. Please welcome Ashley and Anna. Over to you, Ashley.
Thank you, Jude, and hello, everyone. Thank you for joining us. I'm thrilled to be talking today about how to build a strategy for engaging decision makers. I'll start at the very beginning with an overarching statement that your engagement strategy and your advocacy strategy is in fact your organizational strategy. It must be so carefully aligned with your mission and your vision and the character and the identity of your organization, or else it's incredibly tactical and incredibly issue driven and not impact driven. So always think of your engagement strategy as an extension of who you are as an organization. The previous presenters talked a lot about the positioning of impact and how you absolutely must lead with impact. And that is also true with engaging decision makers. Your impact matters. As long as you stay focused on your impact and what you're hoping to achieve, you won't get tangled up in the details of the actual issue. And I have two examples for you, at least on the US level. One was from several years ago. I was leading a charitable giving coalition. It was intended to protect philanthropy and incentivize people to give to foundations and nonprofits. You would think on its surface that nobody would disagree with philanthropy and its merits and that it would have champions everywhere. The reality was that in Washington, this became an issue. It's a charitable tax deduction that we were hoping to save. It became polarized and really vilified as a loophole for the wealthy to evade taxes, an enemy really of raising tax revenue for the government. And so our challenge as an organization and a coalition was to not let this be a conversation about a loophole and in fact get more focused on what the impact was. And the reality is that the charitable giving tax deduction and the spirit of philanthropy and the incentive for people to give was a lifeline, not a loophole. And so our entire engagement strategy was communicating to lawmakers what children in their communities were benefiting from their community foundations and the money that individuals were giving to get these kids, some of them, to get them through the weekend where they weren't going to eat at home, to give them the supplies to even go to school and have a shot at being successful. Those things aren't loopholes, they're lifelines. And so we've been able, through that work several years ago, we still have a charitable tax deduction in the United States. A more current issue that we're facing right now, that we continue to remain focused on the impact, and that has to do with, in the US, the expansion of Medicare to include vision benefits and low vision benefits for our seniors. Okay, we believe, our issue is vision. It's vision for all. It's the empowerment that vision offers. It is the quality of life. It's safety. It's healthcare. However, it is in some circles currently being challenged as an entitlement. And so now we have our issue is vision as empowerment, not entitlement. And think of vision as all of the things that it can help accomplish for a quality of life and people, healthcare and being able to read and still live alone and live independently in their later years, instead of thinking of it as a dollar sign and an entitlement and a handout. And so 2 examples of how leading with your issue keeps you out of the weeds of kind of the more lower level fights that go on. And that's been our strategy consistently with however we go and talk to lawmakers and decision makers. We always start with our impact. And then finally, perhaps the most important thing when you're building a strategy to engage decision makers is your relationships. This is a marathon, not a sprint. And so you must approach all of these conversations with an eye towards the long game on your issue and the future for your issue and the win. And the win isn't a series of little battles. Those are great and they feel good, and you absolutely must be talking to decision makers and getting them on your side for the little battles, but you have to think about the war and with specific emphasis on, again, back to your mission, who you are as an organization. Make sure they know you, make sure they value the impact that you're trying to achieve in the long term. And always keep in mind that even if you're fighting this one battle, it's never over. So that one piece of legislation might be put to rest, but the same people, you will encounter the very same people on the next issue and the next issue and the next issue, 10, 15 years down the road. They're all the same people. And so the way you show up, it will be remembered and it will be valued. And if you've shown up as a partner who has a long-term vision for impact and you can communicate how it matters to those individuals, even if you don't win today, you will certainly win down the road. So with that, I'll turn it over to Dr. Anna.
Thank you, Ashley, and thank you, Jude and IAPB, for this opportunity. So the question I will try and answer in the next 5 minutes is, how can an effective engagement plan help in changing the views of decision makers? And I will just add on to what Ashley has already pointed out previously. And I will discuss 2 points in the next 5 minutes to answer that. The first point I'd like to touch on is information or knowledge. And the second point is how to put that information across to the decision maker, how to engage with them. So with information, we've heard from past speakers that information is power, knowledge is power. You need evidence. And we've got good data at the global level. The World Report on Vision, the Global Burden of Disease, and the Lancet Commission are just examples of good data that you can use. But also important is evidence or data at the local level, the level that you are targeting change. So it can be at the national level or even lower at the district level that you need that data. It's also important to know what the current situation is, what will happen if change comes about, and also what is likely to happen if the current trends continue and if there is no change. It's always good to have knowledge about the decision maker that you're trying to engage and the organization that they represent. What are their key strategies? What are their goals, their vision, their targets, their key priority areas? And knowing these things will enable you to position your area of interest in the right area of their strategy. If you are talking to government, then global initiatives or resolutions can play an important role. So SDGs and the recent UN resolution on eye health will help you make your case for change on eye health even stronger. I also think that knowing who the other partners or the other players are in eye health in your region or in your country is really important. You know, what area are they working in? Are they partners in service delivery or in program implementation or research? And this knowledge will be beneficial to you when you're addressing integration or collaboration. Now, as an advocate, you will need to know all this information well. So if required, you can effectively talk to it in 2 minutes, if that is all the time that you're given. And you'll also need to package that information in such a way that it captures the decision maker's attention. So that brings me to my second point, putting the information across to the decision maker. Now, it is important here to note that you should try and use every opportunity you get to advocate. Now, sometimes that will mean a spontaneous discussion. If you meet that decision maker at a sports event or at a social gathering, and you're given a chance to talk, try and use that opportunity to advocate and advocate well. Otherwise, you'll have your planned discussions, your planned engagements. It works if you could try and be a speaker at an international meeting or at a conference, if you can. Otherwise, if you can get an invitation to be an observer at a high-level meeting, and these high-level meetings will bring together key people, key decision makers, all in the same room at the same time. And even if you're an observer, you can use the times during tea breaks to then engage with those decision makers. You could also schedule a meeting with that decision maker. And if you're given 20 minutes, then you can have good, detailed discussions on the important areas that you are trying to effect change in. I think it's also important to keep communication lines open. That means giving your business card at the beginning or at the end of a meeting. Go ahead and do that. And even, following up with an acknowledgement email after the meeting. I also think that it is important that you need to be involved in discussions. That means you need to be at the table when the discussion takes place as part of a committee or expert group or even task force. That will ensure that eye level is represented at the national level. And even more importantly, that what you are trying to advocate change for can also be recognized as part of a national agenda. So those are just a few points that I saw that worked for me while I was working with IPB in the Pacific office. And hopefully, I hope that they can work for you too. Thank you, Jude. Back to you.
Thanks, Anna, and thanks, Ashley. Again, some really fantastic tips and tricks and clearly laid out for engaging with decision makers. Ashley, you spoke about the long game, and that's just such an important thing we often estimate in how long things take to happen, but also, that you need to engage with the same people for a long period of time. And pointing out the data that's necessary at local to national to district level, an issue close to my own heart, and understanding and knowing the decision makers' priorities to frame how you're engaging with your particular area. Just a few polls that I pulled out in amongst a lot of other good points that both of you made there. I just wanted to sort of highlight with the data piece, we did get a question before about, is this an area, is IIPB or others looking at research coalitions to further the evidence that we do have, particularly at a more localized area or in areas that have little research. And I think that is something that's really important in our new 2030 Insight strategy for the sector, and something that we should be openly discussing, working together around that. Just before I jump to the rest of the questions, we have another poll just to sort of have a feel for what's in the room. People are engaged with decision makers at lots of different levels in this, people that are around in the call, sorry. So there are many activities involved in engaging decision makers, which some are listed in the multiple choice question below. Please select the areas you have been involved in while engaging with decision makers. You can select as many as apply to you, or you can select none of them if they're not relevant. On your screen, there should be a full long list. On the screen that's shared is a shorter list. You can only see the ones that are at the top of the screen. So yeah, you can see the numbers moving quickly there. And while we're just waiting for the poll, Anna and Ashley, I'll just give you a question to think about, and then I'll go back to the poll results and then we'll talk it through. Policy and decision makers often have 101 things on their plate. How did you manage competing with other priorities and issues when you were advocating for eye care? What helped? What were the challenges? So you can just think about that for a second while we go back to the poll, and hopefully we'll get a few more answers here. Definitely sort of close to 3/4 of the audience is involved in building connections and networks to support the case. The next highest is defining the need and the policy issue, something that's obviously vital. And the third most popular or most popular option is developing the advocacy messages. So less experience around presenting to high-level policymakers and providing evidence and support in case for change, and less with organising policy dialogues. So shows a variety of experiences in that, and hopefully, through advocacy to action, we can engage and connect with people that have strengths in those different areas to try and, work together across advocacy. So if we can go back, Debs, to seeing Anna and Ashley, and if you can give us some tips for managing competing priorities with other issues in your advocacy.
I'm happy to start and just underscore what I said earlier. If you've been a friend and they know who you are, they'll give you the 5 minutes. They really will. Obviously, ours is not ever going to be the only issue, but to the extent that you have built that relationship and it exists, you'll have the opportunity to get there here.
Yeah, so the relationship building is really, really important. Anna, do you have anything to add to that?
Having tips, what has worked with positioning on eye health. Where I worked, there's many remote, small and under-resourced island states. So, when you're going to engage with, what I found with engaging those decision makers was, speaking more about collaboration, speaking more about integration, rather than coming in as a siloed program. And, knowing what their priorities were and trying to see where eye health fitted into it. So, many times they'd come and say, eye health, if you put it on the big agenda, it's very small. But if we try to piggyback, say, with NCDs, with our diabetes program, or with communicable diseases, with our trachoma program, and we saw that that worked well, and that would, would sort of elevate eye health onto the national agenda.
Yeah. And I have one last question here from Don, and he's asked a question that I think lots of people have faced. What is the next step if a decision maker is a blatant no about your program or campaign? He says, I realize every situation is different, but it would be interesting to hear how you may have handled a situation like that. Any experience of that?
The answer is no, but don't stop trying. Yeah. What I found, just like what Ashley said, you look at the impact. So, if I'm trying to advocate for trachoma, look at it from the side of the SDGs. Look at it from the side of trachoma helping to meet universal health coverage. And when you get those broad agendas, you put it back to the decision maker. Of course, the decision is theirs, but let them know, if you're working with trachoma, you are meeting requirements of your targets for SDG 3.3, or you are meeting your commitment to WHA or WHO for universal health coverage. And that will start getting them to think of it on a different level or from a different angle. And always keep your communication lines open so that if they want to continue the conversation, you are ready to continue that conversation.
Yeah, great advice. Never give up. Anything that you wanted to add, Ashley? No. Okay. Thank you both, Anna and Ashley. As I could keep going and talking about this topic for a lot longer, but we have the third showcase to move towards now. So thank you for your time. And now for showcase 3, and a bit of a shift in focus. I'm delighted to be able to introduce Kevin Cahill and Shivang Dave. Shivang is a co-founder and CEO of Planoptica, a biomedical technologist and social impact entrepreneur. As a Madrid MIT M+ Vision Fellow, Shivang co-invented breakthrough technology to vastly expand access to vision care and eyeglasses globally. Shireen was awarded the College of Engineering Community of Innovators Dean's Award and completed the program in technology commercialisation and technology entrepreneurship. Kevin is the Honorary Life President for Comic Relief, the UK-based charity, which together with the BBC runs the biannual Red Nose Day. He has established many things. He's established Sports Relief in 2002 and played a key role in the 2005 Make Poverty History and Live 8 campaigns, both large coalitions of charities and campaigns working towards the G8 Gleneagles Summit. In 2007, Kevin was awarded the CBE for services to charity. Since retiring, Kevin calls himself a purposeful meanderer, helping a number of campaigns and charities. And this includes, for the past few years, working with James Chen and the Clearly campaign, and since the start of this year, working with IAPB to build our World Sight Day campaign. So welcome both Shireen and Kevin, and over to you, Kevin.
Thank you. Thanks for the introduction. Thanks also to the previous speakers. I found it very interesting. There's some interesting rhythms through everything that's being said today. Also, I'll start with a couple of disclaimers. One is that I'm by no means an expert in eye health, and also for those of you spread around the world, be it morning, evening, or nighttime, I hope some of the cultural references still work for you. As we've got such a short time, my plan is in 5 minutes to try and make 5 points really, which are built on my experience as a campaigner with Comic Relief, which you just heard about, and which are things that have worked for me and the organizations I've been privileged enough to run over the years. The first, which has been hinted at a bit, but I call it surfing the wave, that it's good on campaigns if you don't have to build from scratch. It's easier to ride a wave than to make one. And so I'd advise people to find partners they can work with, or events that they can piggyback on, that they can hitch their wagon to, that helps build momentum and scale for the work that they're trying to do. A good example from where I stood was Comic Relief was very privileged to have a relationship with the BBC, and its events sat on BBC One, which with the broadcaster. But that meant once that relationship was established, all of the assets of the BBC came into play. It's different channels, it's radio, it's television, latterly it's internet and social platforms, along with producers, talent, and so on and so forth. So it meant we were able to enter the marketplace at a much elevated level because we were able to, as I said, surf that wave. That's the first thing. The second thing is around creativity. We always prized creativity very highly, and we're lucky to have as a founder Richard Curtis, who's gone on to do great things as the UN envoy for the SDGs, but also as a creative artist in the film world in his own right. I often refer to this as behaving a bit like Salvador Dali. If you look at the work of Dali, if you wanted him to paint a beautiful bunch of flowers, a still life, he'd probably paint you the best bunch of flowers you've ever seen. But he was really interested in bendy clocks and in surrealism. And so he mastered the basic techniques and then moved on to add value. And I think if you put creativity at the heart of your campaign, then you win more friends and supporters. People will come to you not out of duty or guilt or anything like that, but because they want to engage with the messages you're putting out, because they're appealing in their own right. So I'd say get to the bendy clock area, move beyond the basics, and make your language and your comms appeal to the widest possible audience. The third thing is we used to have this mantra, which was to make things happen, you have to make things. And I suppose what this means is that, you know, content in the modern world is king, and you have to create content on a much more regular basis than in the past, because of course the internet and social platforms, Twitter, TikTok, everything, they're voracious, and But as soon as you put one message out, it's out of date because people want the next one. And so you'll have to keep working at content. So to make things happen, you have to make things. When we did Make Poverty History in 2005, and we made a film which we called the click film, but it was well-known people, internationally famous people, clicking their fingers every 3 seconds because that represented the time in which a child died in the developing world, tragically. Now the film within the coalition was sometimes a bit controversial. There were 500 organizations involved, but the great thing was it captured the public's imagination and then got millions and millions of views on social media. And of course, then it was cutting through and it was carrying the basic message of the campaign, which was about poverty alleviation. The fourth thing on my list of 5 is know your enemy. What is it that you're trying to change? Some of the earlier speakers have spoken eloquently about this, but be it speed bumps in a local village, be it plastic in a chain like McDonald's, be it changes in legislation or introduction of new pieces of legislation. You need to work very hard before you begin to define who your enemy is and to make that clear so it runs through all of your communications. There's a good quote which someone said, which was, admire, what do you most admire about the people you despise? So, and this leads me to my last point really, which was about an elevator pitch. You need to be able to say very succinctly, preferably in one sentence, what it is that you're trying to achieve. Because I think there's a tendency within the sector to overwrite, to try and get all the nuances of meaning in every communication, but actually you need to boil it down to the simplest rendition of it in order to then start building your communications and your campaigning around it. I, as you'd imagine, I'm a European, pro-Europe, and when Brexit was happening, it was a great kind of worry and concern to a lot of us. But the weird thing is that slogan that they had, which was "Get Brexit Done," which effectively was their elevator pitch, actually did the job for them. And that shows that maxim I was just talking about is what do you admire about the people you despise? And therefore you had to admire the clarity of thought and the consistency of message and the fact that they just had to say that phrase and you knew what it was they were talking about. And it cut through everything else. So those are the 5 things. Surf the wave. It's easier to ride a wave than to make one. Invoke creativity and be as creative as you possibly can. To make things happen, you have to make things, make content and push it out and push it out. Know your enemy, get your kind of strategy straight by knowing what it is you want to change and be able to say what it is that you're trying to achieve in a sentence or even a single phrase. And could we just have the quote up that we were looking at? There have been a couple of great quotes so far, but this one, which I love, from Margaret Mead, is never doubt that a small group of committed people can change the world. It's the only thing that ever has. I mean, that is so true. And I would commend people on this call and others who've been involved in the work on the recent UN resolution, Vision for Everyone, because that started off as a small group of people wanting to raise sight and clear vision up the agenda to the point where it was adopted by the UN and therefore started to be embedded in the SDGs. And that's a fantastic achievement within the last month. I commend everyone who worked on that. And thanks very much. It's my job now to introduce Shivang, who's going to, I think, be the last speaker today. Shivang, over to you.
Thank you, Kevin, and thank you to all the wonderful panelists. I've enjoyed learning about your work. I'm Shivang Dave. I'm co-founder of Planoptica and one of the co-inventors of the QuickSee technology. We're researchers turned social impact entrepreneurs focused on developing new technologies to improve access to vision care globally. And my goal is to share the unique perspective and approach to advocacy that a small tech startup has. And simply stated, our key to success has been to collect contextual evidence in order to effectively develop novel technology, to deploy it in impactful ways, and to create concrete value for stakeholders quickly. We specifically focus on refraction and the main barrier preventing about 1 billion people from having the glasses they need, which you all know is the global shortage of eye care professionals, especially in low resource settings. And to surmount this barrier, we've invented QuickSee, the world's most accurate handheld autorefractor. And to date, our technology has been used on an estimated 3 million people across 30 countries, about half that time during the pandemic. And QuickSee's gained some recognition from the IAPB, SLOR, international design competitions, and our clinical results have been published in some of the most impactful journals in our field. And I present this so you have context on who we are and what we do. And in line with today's themes and tactics, I'll share with you our path for improving global access to vision care and what we've learned about advocacy along the way. And for us, advocacy in its truest form is action. That's been a common thing with all the other panelists as well. And to successfully develop a novel technology and achieve large-scale deployment, action means collecting critical clinical data, real-world evidence of a technology's impact. Without that, you really don't know if that technology is having the impact and should be advocated. This requires designing insightful clinical studies, widely sharing the results with the broader eye care community. And by sharing that evidence, that contextual evidence, it helps the broader community evolve their own approaches, increase their impact, and advance their advocacy for eye care globally. And so I'd like to emphasize, this is not a linear process, but it's an iterative one. And so in our path, we first worked with knowledgeable stakeholders to understand the challenges they faced and what needs technology needed. We then developed early prototypes that demonstrated that the approach could have a basic impact. And then after refining the technology, we collected clinical study data that demonstrated the innovation could be applied to solve broader and more meaningful challenges, such as improving vision care for adults in low resource settings. And then we advanced to harder problems, like demonstrating that the QuickSee could be a valuable tool for child vision screening in these kinds of contexts. And more recently, we focused on publishing a first of its kind study demonstrating that lesser trained technicians armed with QuickSee is a viable, scalable, accurate approach to capacity building for delivery of eyeglasses where resources are severely constrained. And even though we've done a lot of these clinical studies on thousands of patients and across multiple countries, we still remain on this path and continue to iterate. And we continue to gather evidence, evolve our deployment strategies towards larger scale social impact. And my presence here today is kind of proof that ideas and technology can solve problems. And we all know that, next please. We all know that preparation is necessary, but I'd really like to emphasize that action is imperative, and especially when confronting a very challenging problem. And this for us meant collecting the right type of evidence so we could effectively advance our mission. As the previous panelists have spoken, collaboration enhances capabilities. 1 + 1 = 3 if you do it right. And we focused on collaborations where there's shared interests, but also synergistic capabilities. So different capabilities that came together to advance the overall action of the group. And we maintain our own guiding principles, as many of you have, to navigate through critical decisions towards your ultimate vision. But one thing we've realized along the way is it's really important to remain flexible in order to evolve with the realities faced by our partners on the ground. And by empowering the people who are working on the ground, we were able to learn what they could teach us about how to better deploy our technology in more impactful ways, in ways we didn't originally imagine. And the 3 general tactics related to the theme of advancing advocacy through evidence that I like to end with are first, think creatively, be open to new approaches and new partnerships, especially data-driven ones. There are many small and younger players in this field who often get overlooked, and I do believe a lot of them can help us advance our collective goals. Next. Acting pragmatically is really important, and don't wait for a perfect universal solution. I think it's, as long as there's a solid body of evidence, solutions should be given fair consideration. And we can all agree that it's disheartening when we see resulting in action that happens when perfect being enemy of the good mindset prevails in global health. And lastly, I'd like to emphasize again, to work cooperatively, avoid the turf wars, and focus on the larger goal. Realize that there's numerous ways in which different collaborators with distinct specialties can work together to have collective impact, and all of us are needed really to have a change in how the world sees. And I'd like to end with this quote, which by Nelson Mandela, which embodies these principles. And thank you to everyone for your attention.
Thank you, Shivang, and thank you, Kevin. And, you know, a lot of powerful words that have been said tonight and powerful quotes that have been shared about the same themes from many, from a couple of really, you know, great people, and the, of course, the African proverb at the beginning, all saying working together we can achieve more, basically. I took a lot of takeaways, and it's really interesting in the way that we crafted this session, thinking that some of these sections were quite distinctly sort of separate, but a lot of the messaging tonight has been very similar. Kevin, your tips on surfing the wave, harnessing creativity, making things and then making them happen, and down to defining your audience and your aim and what is your message, and elevator pitch. I'm sure there are many of us that would love to have some practice on the elevator pitch piece and getting it right. And similarly, Shivang talking about the evidence which has been brought up in a few different ways tonight, and as I said before, is close to my heart, in particular making sure that we have the right evidence that we need to support the change that we want to make, and that right evidence is a balance, or appropriately global, local, regional, or you know, even local knowledge that is required for things to be appropriate and effective. So we have a couple of questions. They're coming in fast as I'm keeping my eye on them. First question, Kevin, is to you from Louisa. What is the biggest lesson? What is the biggest lesson or greatest learning from comic relief that you could share with the eye health sector?
Well, I guess it echoes a little bit what you were just saying, and what Shivang and others have mentioned about collaboration. I think that I used to believe, going into meetings when I was chief executive, and obviously you're meeting all kinds of people, but some people I was meeting whose, if you like, power and influence was so huge, like the Prime Minister, and that if you could get them on your side, you could achieve great things. And I used to feel a couple of things. One was that there's definitely a sweet spot here in the room. We can reach some position where we agree with each other and where we can get mutual benefit from it. And I think particularly with politicians, if you can come up with ways of making them look good, but to deliver against your objectives and your kind of needs, then I think that's a smart thing to do. And the other thing is, Coral was begun with a passion. Just a couple of people began echoing that Margaret Mead quote. And if you're sitting in a room negotiating with an industrialist or a corporate kind of maven, or a broadcaster or whatever, and your objective is about reducing extreme poverty in the world and helping the poorest communities to fulfill their potential and to move on and become economically empowered, then it's easy to sit there believing your reasons why that person should say yes to you are always going to be stronger than their reasons for saying no to you, because you have that strong moral imperative, which I think is undeniable. So I'd say two things. One was total conviction about your argument and the reason why you were doing what you were doing, and the second was reaching a sweet spot so that anyone can feel that they should take part and give something to the cause, because it's a kind of undeniable argument, really. So there were two things.
Yeah, I think that's really, really wise. And I think there are a lot of applications in eye care, like making poverty histories. Eye care does tend to be really quite universal. And in fact, so many policymakers don't realise that people don't have access to eye care. So it's something that's, an easier win than some other political issues.
By the way, sorry to interrupt, because I've been working with James, as you said, and the Clearly campaign and No World Sight Day, but a comic relief we used to dream of, an issue that was easy to explain, easily diagnosed, where the treatment or solution to it was straightforward and simple, where it was low cost, it would create an internal market, and it would unlock human potential. And those are all the factors that you have in your own sector. There are obviously notable examples with some treatments that are more complex and need a different approach. But for my sense is that the general sweep of it fits into that category. So you have, as a sector, the perfect storm, and the reason to support you is undeniable.
It's very powerful coming from someone who sits outside the sector as well, because we often speak within our own four walls, so to speak. I'm going to just make the next question to Shivang from Jessie. You mentioned, Shivang, during your talk that you felt that there were more players around in the innovation sector or younger players that are not, in organisations that are not included. Could you elaborate a little bit further on sort of what you're talking about and how we can bring the innovation sector perhaps more into the conversation?
Sure. Yeah. Thank you for the question. I think, if you go back to an old book by Thomas Mann on the structure of scientific revolutions, he kind of talked about how paradigms change, and often they change by someone who's outside of the paradigm coming in with a different perspective. And in global health, I think we can become large organizations and become entrenched in our views and kind of think each of our, each organization becomes kind of siloed. They're working towards a common vision, but in a way there's a subtle competition and non-sharing of resources and a bit of turf war. And I think as a smaller player, you definitely see that. I've been in global health for about 20 years, and in some other technologies I worked on, I remember being in a room where we presented something and the larger player instantly dismissed it, and it said they only trust clinical studies they run. They hadn't looked at our papers, they hadn't looked at things like that. And so I have come across experiences like that, and I think they're unfortunate because they're being closed-minded to an outside idea or someone they're thinking as an outsider, but they haven't looked at the paper trail of evidence gathering, of publications, of grants, of partnerships, of impact, just because one doesn't come from the pedigree. So, and I think I really appreciate what Kevin said, because it kind of is the same thing. If you have to learn for the innovators who are trying to innovate and to break in, what I would advise is learn to realize to whom you're speaking and what's important to them, what language they need to be spoken to, right? What kind of data matters to them. So, Kevin gave the example of whether you're speaking to the prime minister or a person you're helping, right? It's a different message. There's different language you need to use to find that resonance. And that's been an evolution process for us. And I think the better we've gone at it, the more we've been able to collaborate with the larger players.
Yeah, look, I think that's one of the key messages that has come through is know your audience, know what it is that you want to advocate for, who to, and make sure you know how to speak their language, have the right evidence, but also weave it within their goals and make sure that their priorities are also being met at the same time, so that there's that sweet spot that a few people spoke about. We're almost out of time, so I guess I just ask either if you have any final comments that you'd like to add. Yeah, and then I'll just wind up.
So it's not a question. Well, I'd like to. I'd like to add that these events like this are great because you get a cross section of views. Where I think the point you made a few minutes ago is that whilst people have different approaches or topics, what you find is this kind of there's a theme running through all of them, and the quotes that were eloquently put by historic figures go to show that one was about moving further by coming together, another the Helen Keller one, and Margaret Mead and the Mandela, and those are greater orators than any of us, and we should take their word seriously. And I think if a webinar like this provides a broader network for some people so they can kind of exchange views and keep working towards this goal of primary eye care for all, it would have played a really important part in that. So yeah.
Thank you. You're on, Shivang.
Yeah, I 100% agree with that, and I think the maybe one more bit I would add. I think the earlier question asked, where do you find these innovators? You can find them at universities, you can find them in accelerators. A lot of us will be reaching out to larger organizations, so just check your inbox. But the one thing is about data collection. I think sometimes we become very myopic about saying, okay, we collected this data in this part of the world, and does that data really apply to this other part of the world? And that is a healthy bit of skepticism we need to have. But we also need to be practical and understand that if you're within the same country, yes, a different region, but for a lot of these eye care diseases, there might be general trends that still hold true. So not over collecting data and really seeing, like, have you collected enough to make that jump and that leap of faith to trying to deploy something and being impactful. That's what I would leave the audience with.
Fantastic, thank you. I'm just going to address a couple of the questions that are a little on the side of what we've been talking about today. The first one was how to involve the WHO in the eye care agenda. That is the topic of a whole webinar on its own. The WHO are very involved in eye care, and you can read through what has happened over the last 18 months or so, the World Report on Vision, the World Health Assembly resolutions last year and this year, and the deliverables of the packages of eye care interventions, the targets and indicators, and the guide to action that will be out later this year. So there is information on the IPB website with, from the WHO in all of those topics, and happy to take an email around that if someone would like to know further about it, but obviously not something I can cover in 2 minutes or less here. The other one was around COVID-19 affecting adaptation to children eye screening programs. This is something, these are types of questions we've had a lot of questions of over the year relating to different areas of eye care and the impact of COVID. The school, I will refer that question to our school eye health working group, and perhaps we can have an exchange around that in that forum where the people who are actually delivering the child screening programs can talk about that. So yeah, I'll also sort of follow up with that question as well. So while today's stuff is all fresh in your mind, and before you run away, we have one last poll for everybody, which we'd really like you to answer. Back to Slido, if you could please just go back there, and we'd really like to know one piece of information that you've heard today that will influence the way that you will work going forward, something that's really made you think differently. So if you can please just enter your answer on that into Slido, that would be wonderful. Just give you a minute to do that, and then I'll talk about what's coming next and some other IPB events. I really would like as many people as possible to answer this question. So if you could just take a couple of moments of your time, it's really helpful for us to know what's sparking your interest and what's making a difference, and perhaps where we should be focusing some of our efforts as well. And your feedback is important to us. So we will leave that poll open, and even though we're going to stop sharing the screen with the answers coming through, I really ask you to please keep answering the question so that we can just finish on time. So what's coming out next? Next we have our exciting workshop on community voices in advocacy. We're up to that will be number 5 in our six-part series. I can't believe we're that far through the year already. It's gone so quickly. And we're really looking, community voices in advocacy will be a workshop. There will be a lot of small group sessions where you can talk in amongst each other and with people that represent different community voices across the sector. And I think it's a real addition to a lot of the messages we've been hearing today around having the evidence that you need. You also local voices, community voices are really, really important in our advocacy efforts. So please join us on September the 7th. The registration will be up in about a week's time, and you can register for that at any time, and we will email you following this. So I just wanted to give a really, really big thank you to all our speakers tonight. We could have heard so much more on each of those topics. and hopefully we'll be able to call you back at other times and do some deep dives into what we were doing. But I hope for the audience that was a good overview on strategies and tactics, some of them. Thank you to the speakers, thank you to our wonderful sponsors, and thank you to everybody who gave up time for being with us today or to watch the webinar online. We really appreciate it, and we love to hear your feedback, so please let us know what you think, what you'd like to know more about, how you'd like to engage, and see you next time. Thank you so much.